for our daily update on the coronavirus outbreak and the basic do's and don'ts that Nigerians need to observe to stay safe from this scourge. We are now being joined here by Dr. Misbah Oleolo, a laparoscopic surgeon and consultant physician at Reddington Hospital, Lagos, as well as Dr. Sylvia Cole, an anesthetist and intensive care surgeon. Welcome to the program.
Thank you for joining.
Well, it's good to have both of you here. Dr. Oleolo, you were on the program on Sunday, and Dr. Cole, you were with us yesterday. As a media organization, we are focusing especially on this coronavirus. We're taking proactive steps to make sure that we don't wait till there's a crisis before we play our own part as, a media organization in keeping the people updated on what is going on and ensuring that government does the right thing. So that's why you are here again, Dr. Cole, this morning. But, in the papers today, we're told that the ambassador of China to Nigeria has assured everyone that no Nigerian living in Wuhan is affected. We're informed that there are 60 Nigerians living in Wuhan North, and that all these Nigerians are safe. They may also have been quarantined, but that, Nigeria shouldn't worry about the safety of its citizens, especially in Wuhan. Is there something to jubilate about? Does that assure us that, we don't have to worry so much? Dr. Oleolo, let me start with you.
Well, I think it's praiseworthy that the Chinese authorities have taken that step. Just as I think it's praiseworthy that they've shared data in a very proactive fashion. It's quite reassuring to know that our compatriots over in China are not affected by the condition at the moment, but that doesn't remove all the precautionary measures that we will be talking about later. So we need to bear that in mind.
Well, Dr. Cole, the Nigerian Center for Disease Control has just disclosed that we now have isolation centers, quarantine centers, one in the Federal Capital Territory and others in 7 states of the country, including Rivers, Kano, Cross River, Lagos, Delta, I think also Enugu. That's the 7th one. Now, as a professional, as someone in the industry, do you have any information about the status of these quarantine sites? And do you think that government has taken the necessary steps? Because it's not enough to just announce that we have designated certain units as quarantine centers. Do you have any information about the status? And do you think there's something that needs to be done to inform the public, particularly as the government is still insisting on a self-quarantine strategy?
I think, this is a news from yesterday, so they're doing what needs to be done. So things are being done, and these areas have been announced, and they will be upgraded to whatever is needed. That is my belief. So I'm happy that the government is taking this step, and I'm also happy that it's in multiple states, because it can't just be in one place. We need multiple centers. And from what we know, the numbers we're expecting that may need to be quarantined are quite large, and they need to be quarantined for 2 weeks. So seeing that we need that and we want that, having multiple centers in different areas is a positive step that should be, the government should be applauded for that. Saying that they shouldn't rest on their laurels and they should still please provide more areas.
Thank you. Now, yesterday we talked about prevention, but of course it bears repeating. So, Doctor, can you tell us how to prevent this virus?
Okay, so the prevention you could probably break into 3 quick strands for simplicity. For people who've traveled abroad, especially people returning from China, very clear instructions to self-quarantine even if they do not have symptoms. Anyone who might have come into contact with someone who's a confirmed case, similarly, needs to contact the Center for Disease Control, and there is a number that they've made available. There may be people who don't have either of these two conditions, who have been in hospitals where, abroad I mean, where there have been confirmed cases. So those sort of people also need to contact the National Disease Control Center number. In terms of you and I, who are ordinary people who may not have been exposed to the virus in that sort of way, the things we need to bear in mind are in terms of the symptoms. So if you're coughing, simple courtesy like covering your mouth with a tissue, preferably, not a handkerchief, because if you do it with a handkerchief, you soil it with loads of viruses which don't necessarily dry up and pass it on to someone else. Single-use tissues, hand washing. There are instructions for people to completely abandon or delay all travel to China, obviously because that's where the infection's originating from. There are also clear instructions to airlines that if they've got passengers on board who've suddenly become ill and who are coming from a potential area that might have infected cases or individuals who've manifested the coronavirus, then they should be informing the Port Health Authority so that adequate quarantine measures can be instituted at that stage. So, and of course there are healthcare professionals, so the healthcare professionals need to abide by very simple protective personal equipment, so their gloves, their aprons, their masks, and hand washing, of course. And I think this is one of the few times where you have to actively encourage patients or people to do some self-advocacy. So you go to see a doctor, you want to make sure they've cleansed their hands and washed their hands appropriately so that we don't transmit this and other potentially transmissible infections.
Absolutely. And before we wrap up the conversation today, we'll definitely share some more information still on how you can best protect yourself at this time with coronavirus. But it's also World Cancer Day today, so that's something that's also great for us to discuss, but not so great when we look at the figures that are applicable to Nigeria, where we have about 102,000 cases every year, but over 70,000 deaths recorded from cancer every year. Now, with advanced technology in the world, in certain parts of the world, cancer is no longer considered a death sentence. Yet it seems as though that is the status that we're still in when it comes to cancer here in Nigeria today. What is the stress and the pressure that is put on private hospitals to really and truly attend to this capacity? Because 72,000 deaths a year is huge, and over 100,000 cases a year is a very large number that we're talking about. Dr. Cole, I'll start with you.
Okay, now we need to remember that that number is also from people who come back, who have lived abroad, have cancer, but are coming home to die. So it's not just, or it's not only people who live here and have the disease, because by the time it becomes terminal, the advice is to go home, go to family, and be in an environment where you're happy, where you can be with family and everything. So that is what I think increases that number a little bit more. By the time that's what, as I said, by the time it's terminal, so you tend to go home. That's one. Another thing is cancer at some point needs a lot of supportive care. And in this country, we are at a point where we do not have enough beds for holistic care for patients who have cancer. So we do not have enough centers that look after patients who need supportive care. We do not have enough beds, intensive care and non-intensive care, high dependency unit care, just to treat symptoms and signs, so to make patients feel better. Because when it gets to certain stages, we're not treating the cancer anymore, we're treating the symptoms just to make them, and that tends to prolong life a little bit more. So that is what we need here. We need a little bit more in terms of centers that can do that.
Well, are there so far lessons that we can learn from China in terms of how China has been able to manage or is managing the crisis? Although, on January 28, they had a spike of almost 100% in the cases reported. Yesterday, they had another spike per day, of about 65 new cases. But in spite of all of this, the WHO Director General, when he visited China, commended the Chinese authorities and even advised that there should be no travel ban going to China. And that's China doing so much. Even the Politburo came out yesterday to apologize to the people of China, to say that, look, well, we think we have failed the people. We've not done enough. There have been omissions, Well, are there lessons we can learn from there in terms of leadership, in terms of response, in terms of being proactive? Dr. Oleolo.
Well, I think there are loads of lessons still that we can learn. Personally, I look at the positive side of what China has done. They reported at the stage where they had 44 cases, they already had those 44 cases reported internationally. They've been very open about their figures with the World Health Organization. They have worked across the board with the international community, bearing in mind that a lot of the response of our own government, apart from it being the initiative of the government itself, has been in concert with the World Health Organization and the Chinese authorities. So they've actually been very open and very proactive. And even when you consider the latest information about Nigerians living in China, I mean, if I had a relative in China, I would want to know that they're safe. And I think it's quite reassuring that they've taken the step to do that. If we look at the response of the government here, I know we're into government bashing quite a bit in this country. This is one of the times when I think the government has taken a series of very bold, proactive steps. Look at on the NCDC, the Center for Disease Control's website, every day there is an update. So all in all, I think it is the openness that has allowed us to have a series of robust responses, which is an advantage as far as I'm concerned, rather than a disadvantage. Could they have managed it any differently? I'm not entirely sure, because let's bear in mind that the World Health Organization defines this as a new strain coronavirus. So this wasn't something that anyone anticipated. Could they have managed it differently? I don't have an answer to that.
Well, thank you very much, Dr. Oleolo. Thank you very much, Dr. Cole. You can be sure we'll continue to focus on this subject to make sure that everyone is safe and well informed. Thank you very much.